Good afternoon, everyone. My name is Janelle McGregor. Thank you all for joining us for our first episode of Real Talk on Rona, being brought to you by the City of Tampa, Tampa Family Health Centers, the Florida Department of Health, and Hillsborough County. I'm here with my co-host, Melissa Garita, Marketing Director for Tampa Family Health Centers. She is going to introduce our guest speaker today, Dr. Monica Ryder, who will be giving us the real talk about COVID-19 and if you are at a greater risk of suffering from the virus. Melissa?
Thank you, Janelle. Dr. Monica Ryder was born in rural northeast Arkansas, just outside of Jonesboro. At an early age, she recognized the limited availability of medical services in the area, and by the age of 6, she decided to become a physician. After graduating high school, she attended Xavier University of Louisiana in New Orleans, where she majored in chemistry and pre-med. Dr. Ryder went on to receive her master's in public health with a concentration in maternal and child health from the University of Alabama, Birmingham. There, she was able to identify how she could best impact the health and wellness of rural and urban communities. After participating in projects and publications, Dr. Ryder opted to take all that she had learned and apply it towards her career goal of becoming a physician. With an unwavering determination to practice community medicine based on her childhood and educational experiences, Dr. Ryder went on to medical school at Nova Southeastern University College of Osteopathic Medicine in Fort Lauderdale, Florida. She completed her residency in family medicine at a community hospital in South Miami, where she was able to meet, treat, and educate patients of various socioeconomic status, advancing her goal of becoming a family physician to those with limited access to care. Upon completion of residency, Dr. Ryder immediately went to work in community medicine at Tampa Family Health Centers as a primary care physician in an urban center. Always seeking to lead and not follow, she served as a physician champion for multiple locations within the organization, mentoring and guiding other providers at Tampa Family Health Centers. Dr. Ryder has served as the interim chief medical officer, the adult medical director, and in her current role as chief medical officer for the organization. Today, she works tirelessly to advance the quality of care that is provided to a population greatly in need of services. Without further ado, I am happy to introduce Tampa Family Health Center's Chief Medical Officer, Dr. Monica Ryder. Dr. Ryder?
Thank you, Melissa, and hello, everyone. Again, I am Dr. Monica Ryder. I would first like to thank the City of Tampa, Hillsborough County, and the Department of Health for allowing us to host this session of a series of webinars. We are excited to bring you some information regarding COVID-19 and the coronavirus and your risk. We hope that it is beneficial to you and your family. With that, let's get started. So first things first, what is the coronavirus? Coronavirus or coronaviruses are actually a family of viruses which can cause illness in animals and in humans. Several of the coronaviruses can cause very mild symptoms, like the ones you would see with a common cold, a typical runny nose, sore throat, cough, mild fever. They can also run to the opposite end of the spectrum and cause more severe disease, like what's seen in severe acute respiratory syndrome, or SARS. SARS was something that was seen in the United States and more in China around 2002, 2003, but luckily there have been very, very few cases noted since 2004. So what are some of the more typical signs you would see with any of the coronaviruses? Again, a little bit of a dry cough that will sometimes develop into a productive cough, fever, and what some people would call fatigue. And what that means is just being more tired than usual, not so much that you would need a nap, but you feel like you could literally sleep your entire day. Some more severe symptoms would include respiratory distress, that feeling of not being able to catch air, no matter how much you rest, no matter what change of position that you have, but also a fever that does not seem to be responsive to Tylenol or ibuprofen or any other over-the-counter medication. Sometimes the more severe disease, unfortunately, can cause you to be admitted to the hospital and sometimes needing ICU treatment. So is the coronavirus or the coronavirus family a new concept? It is not. The family of coronaviruses can actually be dated back centuries ago. The one that's more commonly found, or the viruses that are more commonly found in humans, were identified around 1930 and 1935. But the coronaviruses as a family unit are not new. So how do you actually catch a coronavirus? Like, how are you actually exposed to coronaviruses? Well, studies and research have shown us that right now we know that it is what we would call droplet. Droplet means when you're sneezing or you're coughing, or sometimes, believe it or not, just simply talking. It's the spread of saliva from one person to another. And you've all seen some of the commercials or stories in which a sneeze is almost like a hurricane. The force is that strong. So a simple sneeze without covering your mouth actually can cause a droplet to go from you to someone else within 6 feet of you. How do we treat coronaviruses? Well, unfortunately, there is no set treatment for a true coronavirus. And again, you have to think about the cold. It's honestly supportive care for a simple coronavirus. And supportive care means rest, treating the temperature as best you can with over-the-counter medications, plenty of fluids, and food that can be tolerated. Now, can you be reinfected with a simple coronavirus? Yes, which is evident by people who typically seem to get a cold every November or December when there's a change in the weather. So yes, you can be reinfected with coronaviruses, but it's always about just providing proper supportive care. So what is the difference between coronavirus and COVID-19? Well, we have to understand what exactly is COVID-19. COVID-19 is technically the name of the disease that is caused by the coronavirus. So we have to make sure that we understand that COVID-19 is caused by something called the novel coronavirus or new coronavirus. And we call it new because this is something that is newly discovered in humans. Okay, so it's SARS-CoV-2 or novel coronavirus. It is spread in the same way that most coronaviruses are spread, mainly person to person, and again, it's via respiratory droplets that are again produced when you cough or when you sneeze or when you talk. We often talk about the patients who are coughing or sneezing around us, but remember, actually, coronaviruses can be spread by people who are showing no symptoms at all. You can feel perfectly fine and have a little bit of a runny nose and think you're just having allergies, but that actually might be a sign of being infected with some type of coronavirus. So we often do tell patients, please, especially in this time, outside of covering your cough and covering your face when you are sneezing, don't share cups, don't share plates, don't share forks. Anything that can cause you to pass saliva to another person, you need to limit that because that is actually one of the ways in which we are unfortunately spreading this virus. Again, some of the symptoms. Now, COVID-19 is presenting with symptoms that are a bit more severe than the common cold. So yes, there's fever and cough, but the shortness of breath, chills, and muscle aches and headache are some of the key factors that are letting us know that this is more than just a common cold. There are also reports, and you can see this with optometrists are actually reporting that there's an increased risk of conjunctivitis or an infection in your eyes. You'll see the redness, a little bit of discharge. That has actually been shown to be a sign of coronavirus infection as well, or of COVID. So let's see here. So how do we test for the COVID or coronavirus and the COVID-19? One of the main ways that many people or many organizations are testing for right now is through a swab. So what it is it's an uncomfortable situation, but it is a long swab that is inserted into the nose, into the nostril of the nose, and is pushed back to the back of the nose all the way to the throat. It can cause a lot of patients to sneeze. It can be a little bit uncomfortable or maybe a little bit of a tickle. Some people say it actually even makes them gag just a touch, but a little bit of discomfort to find out your results is absolutely worth it. But we do swab in the back of the nasopharyngeal area, which again is the back of the nose, touching the throat, and this particular sample is sent off to a lab to be evaluated. Unfortunately, the results can take 5 to 10 days. It really depends on how busy that particular lab is. But that is one of the most common ways in which many organizations, including our own, are actually testing for the coronavirus. There is also a throat swab that's not as uncomfortable as the nasal swab, but the CDC right now is actually encouraging us to do the nasopharyngeal swab at this time. There is something that we call a serological test or a blood test. The blood test is testing for antibodies or an exposure. This test is looking to see if you have ever had the virus, or maybe you have been around somebody with the virus and your body just did not react to it, but now you are actually just carrying the virus, so to speak. It helps us, and this data will actually help us once we get past this, what's called the peak, and it will provide us with information regarding treatments and possible vaccines. We are fortunate in Hillsborough County that there are multiple sites that are actually performing tests. I can list a few for you right now. There is the East Tampa location. It's Lee Davis Community Resource Center, the Plant City Community Resource Center, the South Shore Community Resource Center in Ruskin, and testing is actually even being done at Adventure Island. As you all may know, the Raymond James Stadium has been doing testing for a few weeks now, but as of right now, they are only testing patients who are symptomatic and who are meeting particular testing criteria. If you are interested in further information about some of those testing sites, please feel free to call the number 813-272-5900. Again, for more information about the testing centers around the Hillsborough County area, please call 813-272-5900. And of note, organizations like Tampa Family, we are providing testing, but as of right now, it is testing for our own patients. But please know that there are multiple sites around the city that are performing testing so that we can get more information about patients who might be positive or might have been exposed. So how do we treat the coronavirus or COVID-19? Unfortunately, at this time, there is no treatment for the virus. There are many labs that are working feverishly to find treatments for the virus, but there are also people working on a vaccine. As of today, we are strongly enforcing supportive care. If you or someone you know has been exposed to somebody who has tested positive, we are strongly advising you to stay home, self-quarantine for 14 days, stay home for at least 7 days after all symptoms have started and subsided. But right now, supportive care is all that we can provide. And again, supportive care includes taking care of that cough, taking care of that fever, resting, and engaging in proper hygiene protocol, washing your hands on a regular basis, disinfecting your home with the products that have been approved by the CDC and the FDA. And also just making sure that you can self-quarantine yourself away from anybody else in your home so that you don't continue to spread the virus. Does it come back? COVID-19, like any other virus, it is an infection, and it does have the capability to come back and to reinfect people who have been exposed to the virus before, which is why we are encouraging everyone, if you have been around someone who has tested positive or you have been exposed or you yourself tested positive, continue to engage in proper hygiene protocol. It's not enough to say I've already tested positive, I should be fine. We have already shown that people who tested positive before will test positive for the acute virus again. And it is most likely due to the fact that they were around people who did not engage in proper hygiene protocol, did not properly swab down their homes, did not properly cover their face when they were out in public, did not wash after touching elevator buttons or doors or things of that nature. So yes, it can come back. You can reinfect, but the best way to decrease your risk is to engage in proper hygiene. So speaking of risk, who is at risk? Technically, everyone, all ages, everyone is at risk for contracting COVID-19. But it's the level of severity of the symptoms that we worry about. So the older population and people with pre-existing conditions like asthma, COPD, high blood pressure, heart disease, diabetes, unfortunately, they are at a greater risk for developing severe illness. And of course, we are all seeing the reports of patients who are absolutely healthy, and unfortunately, they are being admitted to hospitals with severe symptoms. So we are still collecting data as a nation regarding those patients, but we know for a fact that having asthma, having chronic obstructive pulmonary disease or COPD, heart disease, any of those other conditions that I mentioned, actually increases your risk of developing very severe disease. So that particular population is what we would like to call the target population. If you find yourself in that target population, you need to stay home. You need to self-quarantine yourself away from anyone who is going out into the public on a regular basis to decrease your risk of contracting the virus and unfortunately developing severe symptoms. It has been noted in the news lately that the African American population is at an increased risk of death. You may see the rates of infection of African Americans might be lower than their counterparts, but the risk of death is actually quite higher. And there is a linkage because the African American population has a higher rate of diabetes, there is a higher rate of high blood pressure, and there's a higher rate of heart disease. So again, those particular populations with pre-existing conditions, unfortunately, are at risk for developing more severe illness, and unfortunately, that does increase their risk of death. So how do we decrease, or how do we prevent the spread of the infection? And you're hearing this all over, all in the news, all in social media. Stay home. It's one of the safest things that we can do. It's one of the best things that we can do to truly, truly flatten the curve and to decrease the risk. We are asking everyone to do their best to avoid any area that would cause you to be close to someone. And that includes a lot of situations that people kind of take for granted. So I can speak to home gatherings. That's something that you think like, oh, I'm just going out with, or my mom's coming over, my aunt's coming over, I haven't seen my grandmother in a while. And you're assuming that it's safe because it's family. But you always have to remember, you don't know everywhere that your family member has been, and you don't know who they have been around. So your aunt or your grandmother, she may want everyone to come over, and she's running to her local grocery store because she wants to make a big meal for everybody, and she runs to Publix. She herself might be wearing a mask, she might be wearing gloves, and she might be following proper protocol, and she's standing on the taped X's on the ground to try to adhere to the rule of the 6 feet social distancing. But the worker behind the counter might not be wearing the proper mask. They might not be wearing their gloves. They unfortunately might have a little bit of a sniffle and sneeze. That person might unintentionally infect your family member. You go over to that family member's house thinking it's innocent because they're your family and you assume to know where they went. And unfortunately, they've infected you and anyone else at the home. It is best to just stay home and avoid any type of home gatherings, any church functions, any outings at the park where it might be a group, because we are still seeing, unfortunately, there are trainers or there are people who are out still trying to go to the park and meet in groups and exercise. We understand that you want to stay fit. We understand that you want to keep your activity up. that you unfortunately do need to do it solo or do it only with members of people in your home. Another way in which we are trying to get everyone to prevent the spread of the disease, just simple hand washing. It's, yes, you're in your home and you're washing your hands after you cook or after you clean or after you touch anything in your home. But remember, you go to the store, you're touching a shopping cart that 50, 60 to 100 other people have already touched. And we're so grateful that a lot of the chains here in Tampa are actually washing the carts and sterilizing the carts before you touch them. But sometimes there is that stray cart that's out in the parking lot and you're not thinking. You touch the cart, you go in the store, you do all your shopping, you come home. In that time frame of you being out to the store, talking with the clerk at the store, loading the groceries up into your car, getting into your car, singing along to your favorite song, you've probably touched your face, your nose, your ears multiple times. You must wash your hands. If water and soap is not available, we completely understand you don't have that while you're out at the store. Please get a small portable container of hand sanitizer and sanitize your hands as best as you possibly can. Make sure you get into the webs of your fingers. Try your best to get it underneath your fingernails. But the most important thing with that is washing your hands. Use your elbows when touching the elevator buttons. And that may seem silly, but how often do you actually touch your face with your elbow? You don't. So it's safer to use your elbow than it is your hand with touching an elevator button. Nothing can replace staying at home and social distancing when you have to go out. We understand that there is a sector of the working class that cannot work from home, and they must leave their home to go to work, or they must leave their home to get groceries for their family. Please, 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 we encourage you to, yes, wear a mask, but the mask does not protect you. We also encourage you to practice safe social distancing. Please we continue to encourage you staying away at minimum 6 feet. We are saying 6 feet, but 6 feet is the minimum. 6 to 9 feet is actually the best distance for you to stay away from anyone that's in your in the vicinity. Okay. Also, if you're at home and unfortunately you are developing symptoms like a low-grade fever, you are having a cough, unexplainable chills, fatigue, do not go straight to your provider. Do not go straight to the office of your doctor. Please call them first. There are many primary care offices that have set up telemedicine, or they have nurses on the other line that can talk to you about your symptoms and best guide you on what next steps to take. It might be that they don't need you to come into the office and that you can go straight to one of the testing centers based on your symptoms, or you can be given guidance over the phone to allow you, number one, to stay home and stay safe, but to also not spread the infection to people within their office. Last but not least, we really, really want everyone to make sure they stay up to date on the most current information regarding the coronavirus and COVID-19. And one of the best places to find the most up-to-date information is the CDC and the Florida Department of Health. As of this morning, it was noted that Hillsborough County had 979 confirmed cases, 20 deaths, with the average age being 45. So again, no one is immune. We are all at risk. So we do kindly ask for you to please stay at home, practice social distancing, and wash your hands. With that, we are open to taking questions, comments, or concerns.
All right, looks like we do have one question that just came in on social media. It says, do I need to social distance if I'm wearing a mask?
That is a great question. We do encourage you to still engage in social distancing while wearing a mask. What we need to remember is that the mask is not protecting you completely from contracting the virus. The mask is in case you have a little sniffle, you sneeze, you cough, at least you're decreasing your spread of the actual droplets into the air. But many studies have shown the masks, the typical masks, the cloth masks of the bandanas or the t-shirts that we are very grateful for the community for producing, that actually does not stop all droplets from spreading into the air. It is decreasing, and it actually helps to spread those droplets in a different dispersion. It helps it keeps it from going straight to a person that might be standing right in front of you. But it is still known that droplets do seep through the masks. So if you continue to engage in social distancing with 6 feet at minimum between you and anyone around you, you are putting up yet another barrier to decrease your risk of contracting the infection. Now, I'm glad the masks were brought up. We are encouraging you, yes, to wear masks out in public, but that's in those settings of, again, when you have to go to the store, or when you know you're standing online at the pharmacy to get your medications, or anywhere where you know you're going to be unfortunately forced into a situation where social distancing might be a bit difficult. But we do not want you to put masks on children 2 years old or younger. And we also ask that you not put masks on patients who have difficulty inherently with breathing. If they have shortness of breath, COPD, again, it's not controlled with their current medications or inhalers. Number one, they really shouldn't be out anyway, but having a mask on can actually make their breathing symptoms worse. If you do have a mask that is made of a bandana or a t-shirt or some type of cloth material that someone sewed for you, please be sure to wash them regularly. If you are fortunate enough to have a filter in that mask, remove the filter, and wash the cloth in the washing machine like normal. You need to do your best to keep those masks clean. We, as a medical community, are begging the public to not purchase N95 respirators nor surgical masks. They are unfortunately still in a short supply for medical professionals, and vendors are doing their best to provide those masks to those hospitals that are dealing with the sickest of the sick for patients. So the CDC is encouraging patients or people, when you go out in public, to wear a cloth mask, but they are also stating that you must still engage in social distancing.
Thank you so much. We have another question that came in from a listener who wants to know, should someone get tested if they don't have any symptoms?
That is a really good question.
Symptoms to get tested.
I'm sorry, could you repeat the last part?
I'm sorry. Or do you have to have symptoms in order to be tested?
At this time, the majority of centers that are testing around the county are requiring that you, yes, have symptoms, but also meet the other criteria that has been established by the CDC. The hope is, once there are more advancements on the antibody testing, we will be able to test those patients who are asymptomatic or not having any symptoms.
All right. Now, just recently on the news, there apparently was a report about the spread of the virus through dogs. Can you give some more information on that? Is that true, false? How should we interact with our cuddly animals?
Yeah, so as a pet owner myself, I do understand that our pets are members of our families. They are our little fur babies. And there was actually a positive case, getting feedback here. There was a positive case of a tiger in a zoo that unfortunately, the tiger did test positive for coronavirus and for COVID-19. So again, we do have to remember there are multiple coronaviruses, and they are found in animals and in humans. Dog and cat and human makeup is actually quite similar. So it's not getting a lot of feedback, but it's not too far-fetched to have our pets as positive for COVID-19.
All right, well, that concludes our first episode of Real Talk on Rona. Thank you so much, Dr. Ryder, for sharing this critical information about coronavirus, or the Rona, as some call it, with us today, and letting us know the severe impact this virus can have on individuals of all ages, especially those who are already suffering from pre-existing health conditions. The Rona, the Rona is real, people. We have to realize that it is real. And if you or someone you know have any symptoms, please go get tested. Hillsborough County, as Dr. Ryder said, has 2 drive-through testing sites, one at Raymond James Stadium and a new site at the Lee Davis Community Center. You don't need insurance. The test is free. All you need to do is call 813-272-5900 to make an appointment. Coronavirus is not a game. It is a deadly virus, as you've just heard on this webinar. So if you feel you need to get tested, please do so. We want to thank everyone again who tuned in to this webinar today. Don't forget to tune in with us next on Friday at 12 p.m. to learn how to identify symptoms in your children and what to do if they've been exposed to coronavirus. So you definitely want to tune in then and hear how we can keep our little ones safe during this time that we're faced with. Thanks again to Dr. Ryder and the Tampa Family Health Center staff, along with our partners at the Florida Department of Health and Hillsborough County government for helping to make Real Talk on Rona possible. Stay calm, stay safe, and stay informed. We'll see you next time.